Jordan, thank you. Now, hospitals throughout Utah, they are seeing their intensive care units becoming fuller, and it's happening faster. The Utah COVID dashboard definitely showing ICU usage is more than 85%. Jordan Burroughs did learn a lot today about what happened. We sent him to breaking news, but he's learning what's happening for various hospitals across the state. Intermountain Healthcare is in what they told us a contingency mode where they're turning regular hospital beds into ICU beds. So we asked Dr. Mark Ott, can hospitals even keep up with this demand? And when and if the crisis point could happen, what does that mean? For example, some hospitals are experiencing a crisis mode already, while others still have resources.
We have had to expand our ICU capacity beyond our normal complement of staff and beds.
More staff and more beds are a part of Intermountain Healthcare's contingency plan.
We're committed to doing whatever it takes to avoid crisis mode.
According to the Utah COVID dashboard, 85.6% of all ICU beds are being occupied. That is over the threshold of utilization, which is deemed crisis mode. But Intermountain Healthcare has not reached that point, and the hospital chain hopes not to.
Who gets what beds, who gets what resources? And that's the point that we never want to be in, because that's sort of a rationing of care.
This is the reality for some nurses in the ICU watching patients suffer from COVID.
Some days you go to work and you really hope that just someone doesn't pass away on your shift.
It's hard to explain, I think, to someone who has never seen critical illness what it's like without sounding somewhat scary or sounding like we're over-dramatizing the situation.
An average COVID patient spends 10 to 14 days in the ICU, but Dr. Ott says they could be in there longer, dealing with
complications of clotting, bleeding, or your things that are affecting your gut or your brain or your heart.
So much to unpack there. Dr. Ott says he still wants people to know the healthcare system is still there for them. So regardless of crisis mode, well, we don't want you to not go to the hospital, he says, if you're experiencing symptoms of a stroke, a heart attack, or anything life-threatening. Again, you do want to still seek out medical care. Thank you, Jordan, for that report.